Hello, I am Jihad Mustapha from Advanced Cardiovascular Centers in Michigan. Today I'll be sharing with you my experience with the Sublime platform balloons. These balloons are unique in a way that because they have features that are all combined together in a single balloon. That is dependability, pushability, and trackability. And it's not very common that you can actually get all three together in a single balloon, especially with a long shaft balloon. Therefore, these type of balloons are the best balloons today in the market that will make you go from contralateral approach to reach the tibial-pedal junctions. And that is extremely important for you to remember because tibial-pedal revascularization or reconstruction of the pedal loop is not as easy as it sounds, especially when you go from a contralateral approach. Our experience has been phenomenal with this technology by utilizing a contralateral approach to revascularize the tibial-pedal junctions as well as the tibial arteries and SFAs. I'll be sharing with you today a unique case. So, 63-year-old patient with critical limb ischemia, already lost the right great toe, had an angiogram done of the left leg at the same time, and also got the SFA treated, but we found that it's got severe disease from the popliteal, tibials, and pedal arteries, and we need to treat this patient from an up and over approach. The angiogram here shows that maybe the PT is a little bit on the smaller side, the perineal is occluded, and the popliteal has some disease, and you see that the pedal circulation is not very friendly. So we did the intravascular ultrasound, and we found that there's severe disease, so we treated that, and then we realized that the anatomy in the tibial-pedal area was not kosher, so we decided it's possible anomalous takeoff of the posterior tibial. So we did retrograde access from the posterior tibial artery to finalize the therapy of the popliteal tibial junction. Now you might look at this and say, oh, this is not a big deal, the balloons and the angles. Now this is a takeoff of the posterior tibial artery from the perineal artery. It happens about 6% of the times. After using atherectomy in TPT and perineal, we used balloon angioplasty, and we used a 3.5 to 20 Sublime balloon. And notice how the balloon is able to actually go throughout all the angles that are facing to that point. Furthermore, we tried to use another balloon here, not Sublime, initially, and try to take it through the multiple 90-degree angles to reconstitute perineal, take off the PT, and then posterior tibial artery, common plantar artery, lateral plantar artery, up into the arcuate artery, and that didn't happen with the balloon. We spent a lot of time and money on balloons to do that. Instead, then we went and used the Sublime 2/220. The one thing about this balloon is you always have to be careful because this balloon just goes to where it needs to go very quickly, and you can see here quickly it went down to the distal branches after we struggled before. Now what I want you to think about how many angles resistance this balloon had to go through, and it went there very quickly, and notice how all these angles did not actually stop this balloon from getting there very quick. The beautiful results that you see here are phenomenal because otherwise this limb salvage would not have happened. And notice how the flow into the forefoot, the dorsalis pedis, lateral plantar, the posterior tibial, anomalous takeoff all have a brisk flow in them. This is the example of where if you want to save time and money, which is the most crucial things for patients on the table, you don't want a patient sit on the table for two hours. If you can actually use a balloon that you know you can depend on to get there every time, go for it, because this is the time where you save money and you save time, but most importantly, you can save limbs with a new technology for a complex disease that progressively getting worse. I'm glad that I was able to share this experience with you. Hope you enjoyed it. And it's Dr. Mustafa. Thank you.